With me now is Dr. Michael Howlett, President of the Canadian Association of Emergency Physicians. Doctor, good morning. Glad you could be with us. How did we get to this point where ERs are having to close their doors?
Thank you for inviting me on the show. Thank you. There are two major problems that are happening in healthcare and especially in hospitals right now. The first is crowding of patients in acute care hospitals, and the second is a decrease in the nursing and the physician workforce. There are three main reasons why this has happened, and the reasons go back over 30 years. In the early 90s, pundits for health reform said we had too many doctors and nurses and our system was too big and inefficient, and healthcare workers and jobs and educational spots were cut. And we know now that we have cut too much. The second thing is that Canada's population is getting older. We will continue to have more and more people in their 70s and 80s and 90s who are increasingly frail and have complex healthcare needs. People don't stop getting sick because we want them to. It's the human condition. The third thing is that community care and primary care has not kept pace. We simply don't have enough resources in the community so that when the elderly frail are finished with their acute care in a hospital, that they can quickly and efficiently move back into the community. And so they wait in hospitals sometimes for weeks and months, and these patients represent at least 20 to 30% or more of all patients in hospital beds across the country right now.
So
at the other end, I'll just tell you, at the other end of this, in the emergency department is where the problem shows up, because when we can't get people in hospital easily, they start to pile up in the emergency department. And stretchers are used up, and hospital spaces in emergency departments are used up, and we start to have to see patients in chairs and on stretchers, and admissions take many hours and even days. And this puts a tremendous burden on the hospital staff, who then become more and more fatigued and burnt out, and their ability to keep up and provide good quality becomes more difficult. Then they start to get sick, and then they start to leave their jobs. And so now we have this perfect storm of incredible acute care need, lack of community resources to decant those needs, and then emergency departments burdened, and the staff that's needed to take care of those patients is decreasing.
And is redirecting patients to hospitals outside of one's community really the solution?
No, it's what we do when we have no other choices. And of course, rural departments and remote departments are usually the first to suffer. So you see that those places that have very little redundancy, very little ability to cope with gaps in care, they end up closing first.
Doctor, as we mentioned, and as you know full well, healthcare is top of the agenda as the premiers meet in Victoria, British Columbia today. They want more money. Can money fix these problems that you have outlined?
Well, I wouldn't put it quite that way. I would say we need targeted investment. We need changes in the system. We need, first of all, a better approach, a more radically different approach to how we take care of the elderly in the community, so that hospitals aren't taking care of that burden and restricted in taking care of the acute care needs. And secondly, we need to improve our ability to provide a workforce of physicians and nurses and other allied health professionals, home care workers as well. And so what we really need is targeted investment in these areas. And this is because over many years, they have been underfunded to the point that now we have no redundancy left in the acute care system, and it's starting to fail.
Dr. Michael Howlett, thank you so much. Dr. Howlett is the president of the Canadian Association of Emergency Physicians.